Now let's take a look at some of the diseases and how they will look. The pictures that I've chosen today represent the lesions that you will see with these different diseases if you select acutely affected animals. As I said, if you only do necropsies on animals that have already died, they nearly will all look the same anyway. So these are animals that you have to take time to pick out. These are animals that may still be eating a lot of feed. These are animals that will be running high fevers if you take their temperature, that have clear mucus running from their nose, that are just a little slow, that may be breathing just a little hard. Those are the animals we want to choose. PRRS virus. Acute lesions with PRRS virus will be diffuse. It has a bit of a brown or dark color. And can you notice how this lung is somewhat mottled, where the entire lung is affected and it has this discoloration. When we cut across this lung, it will be very moist. A lot of edema in this lung. This is what it looks like when we cut across it. We dark pink or brownish colored, very moist. When you blot the surface of this lung, fluid will just keep running out of this lung in acute PRRS. This is the stage of disease when you might expect to also have pigs in a nursery develop strep meningitis. And then finally, in some of these cases, when the pigs have been up and walking around, you notice that there's a line on the lung, and this is darker here. This is because the fluid has run down into the cranial-ventral portions of this lung. If I cut across those portions of the lung, they will be very, very wet. Lots of fluid in them. But this is still just viral pneumonia. Swine influenza. I want you to notice, doesn't this look almost exactly like the PRRS lung that we just looked at? Oftentimes, if we do necropsies on one or sometimes many pigs, viral diseases will all look the same. We cannot differentiate them often based only on lesions on the farm. We cannot. It helps if we've walked through the pigs. Pigs that have acute PRRS generally will not be coughing very much at all. Pigs that have acute influenza will often be coughing a lot and coughing loudly because it affects the epithelium in the airways. In this case, we have a diffuse lesion. This lung will be slightly firm, just like the PRRS lung. This lung, however, looks differently, doesn't it? This is the checkerboard pattern that I was talking about. When you see this pattern where you have these individual lobules that are affected throughout the lung, that suggests that the epithelium to various airways has been severely damaged. This lesion suggests we have a virus that affects airway epithelium. The most common would be swine influenza virus in most countries. Ojeski's disease virus can cause this lesion sometimes, and in some of your countries there may be a few others that can. But influenza would be my first differential around the world for this lesion. And this lung is a bit of both. This is also swine influenza. You'll notice that it's a diffuse lesion and we still have individual lobules affected all the way to the back of the diaphragmatic lobes. But here, in this portion of the lung, this portion is also very wet and heavy. When I cut across it, there's actually a little fibrin on the surface and there's pus in this lung. This is a pig that has swine influenza as well as Pasteurella multocida, as well as Haemophilus parasuus. But swine influenza in this pig was the initiator. Ojeski's disease. In this case, again, it looks very similar to the other lungs that we saw. I can't really tell the difference in most cases. Here we have some hemorrhages over the surface of this lung. These lungs are slightly firm, they're moist, they're affected diffusely. We also have another lung that again is just diffusely affected and wet and moist. When we have nursery and finishing age pigs, we may also have a few pigs that have subtle nervous signs that will help us determine we have Ojeski's disease, or we may not. And then finally, these lesions we can see with Ojeski's disease when we are usually in pigs in the nursery or younger. that will help us. Remember, if you never split the head and if you never look at the nasal cavity, you will never have the benefit of seeing this lesion. And this lesion is very typical of Odgesky's. It will not always be present, but if it is present and you have respiratory disease, you can have a good idea Odgesky's may be involved. We have a severe fibrinonecrotic rhinitis in this pig. This is a nursery age pig. I apologize for the picture. This is a gloved hand. This is the larynx. The top of the larynx and trachea has been opened. This is the laryngeal cartilages, and this material here is again necrotic tissue and fibrin in the larynx and the trachea. So we have a fibrinonecrotic laryngotracheitis with Odgesky's disease. We'll usually see this only in nursery age animals, but not in animals that are older in the grower or finisher. And then finally, and I apologize, this is not a good slide at all, to orient you. This is a head. We are looking at the hard palate, the roof of the mouth. This is the pharynx, so we are looking at the pharyngeal tonsil in the soft palate right here. And on the surface of this tonsil are all these little bumps. And if you cut across those with a knife, they each have a small amount of necrotic white material in them. We're actually looking at necrosis of the lymphoid tissue in the tonsil follicles. And you will see tonsillar necrosis in young pigs sometimes with Odgesky's disease. So again, we need to be looking at these things when we're doing necropsies, because this will really help us, especially in nursery age pigs, if Odgesky's is starting there. Finally, mycoplasma. Nearly everybody in nearly every country deals with mycoplasmosis. A cranial-ventral lobular distribution. When we cut across these lungs, when we look in the airways, we will have pus that also, as we take forceps or our knife, it will string because it has a lot of mucus in it. That should help us get an idea that we have mycoplasma, that we can test for mycoplasma. Also understand that just because you have a positive test result for mycoplasma does not mean you have mycoplasmal disease. Right? Colonization for mycoplasma can occur at a very young age. You can have positive test results, and you may not have any significant clinical mycoplasmosis, and you may not have any significant pneumonia caused by mycoplasma. So it requires, well guys, it requires a pathologist to tell you you have typical lesions as well as positive test results to tell you that you have the organism. Finally, actinobacillus pleuropneumonia. Here we have a lesion that is fibrinohemorrhagic, fibrin and hemorrhage. What will this lung feel like? Very firm, like a rubber ball when you push down on it. We see in this part of the lung that the lung lobules are separated by bloody edema fluid. So that indicates we have hemorrhage in this lung. On the surface of the lung, we have fibrin, so we have fibrinous pleuritis. And on the surface, the fibrin sometimes will be thin, and we have this appearance where it's rather granular. And then on cut surface, we have areas like this that are kind of granular. When we scrape them with a knife, they easily flake apart. It's necrosis and hemorrhage. And then surrounding these areas of necrosis, we have these white lines. Those white lines are areas of fibrin and white blood cells that are surrounding the areas of necrosis in the lung. It's the reason the lung is so solid and firm in the feel of it. What other organism can cause a lesion that can look just exactly like actinobacillus pleuropneumonia? On occasion, actinobacillus suis can cause a lesion looking exactly the same. But typically, you will only have 1 or 2 or maybe 3 pigs involved. not nearly as many pigs as with Actinobacillus pleuropneumonia. Now finally, in PRDC, oftentimes when we're doing necropsies on farms, if we wait till animals are died, or if we pick out animals that are still living, but now they're thin, they have been off feed for several days. When you watch them breathe, their sides, they're breathing like this. When we do necropsies, this is what the lungs will more look like in those situations. We could have nearly anything or everything in lungs that look like this. In this case, we found PRRS virus and porcine circovirus type 2, as well as several different bacteria in the cranial-ventral portion of these lungs. In this set of lungs, we found PRRS virus, porcine respiratory coronavirus, Pasteurella multocida, and Streptococcus suis in these lungs. So it's very important that when we're doing our necropsy exams that we select those earlier animals so that we can find the other organisms. It's very important that we find all of the organisms in these lungs if we're going to effectively develop a strategy for eliminating or preventing disease.